Clinical commissioning groups are obviously at the forefront of the changes of the NHS reforms. They are opportunities for bringing GPs along with other colleagues into groups within the local areas, so that the 211 CCGs that there are across England have a focus on the local health needs of their patients. They will work alongside local authorities with their area teams and with the health and wellbeing boards to determine what actually are the local health priorities for the population. So we'll be charged with talking with patients and gaining patient feedback into the kind of services that are currently being delivered and the kind of services that are needed to try and improve health outcomes. Local professional networks will be bringing the clinicians together, whether it's eye health, whether it's pharmacy, whether it's dentistry, to maximise the potential for bringing the agenda for those health specialties to the fore. And it's really important we make sure that local professional networks have a structure to be supported from a national perspective as well as a local perspective. It's a really big ask, huge ask for local professional networks over quite a significant geography to be able to create a network of clinicians who will be able to change clinical practice. So my role and the role of NHS England is to try and create the right environment for that to continue, and that to be able to be shaping the movement of care more away from hospitals and into the community where patients can have a better access and often a better experience as a consequence. So in doing that, we need to make sure that we actually have good clinical involvement throughout the work that NHS England and the clinical commissioning groups are doing, and be able to form a network whereby we create that energy, the innovation, the different ways of doing things. So by shifting the focus from primary care trusts, SHAs, to clinical commissioning groups and area teams with, in particular, the local professional networks, it means that we are engaging far more with clinicians. So what the focus of the Health and Social Care Act is about making sure clinicians are in the driving seat, whether they are GPs within a CCG, or whether they are a dentist, or optometrist, or hospital consultant and eyes. They are all involved in how that will come forward with the local professional networks in describing best care, best practice, and creating the care pathways that will actually locally allow patients to receive the care that they need for the outcomes that they want. The reality is that we're only 3 or 4 months into the system, with NHS England taking over the reins from PCTs and SHAs on the 1st of April. It's too early to expect a significant change across the whole of the profession. But we're already seeing some really innovative ideas coming forward. Some local professional networks are really inspired and going forward to create opportunities for patients and to do things differently. And some of that's already showing good outcomes. We've also got and worked with LOCSU for a quite considerable amount of time to understand what will be opportunities going forward for optometrists and others within the eye health agenda. And so we have a good understanding about where we need to go in terms of unlocking some of the potential for optometrists and the local optometry committees as well. So there is about trying to bring together a large network of clinicians and understand the forums that already exist. The NOC is a wonderful example and a wonderful opportunity for optometrists and others to be able to explore what's going on, and a wonderful opportunity for NHS England to be able to access that rich variety of views and thoughts so we can actually incorporate that going forward.